Our patients will ask anything from, if I'm snoring, do I have sleep apnea? Is it only snoring that has sleep apnea? And we can't tell you. You'd actually have to come in so we could physically see you. Sleep apnea is someone sleeping and not getting enough oxygen. Now, sleep apnea can be someone that's not making a sound. This is one thing I really want people to understand. We'll talk to a person that has a sleep study and it says that they have sleep apnea, and they won't believe it because they'll say, I've never snored. No one's ever reported that I make any noise. Sleep apnea, you can just hold your breath and end up gasping for air awake, and literally that's sleep apnea. Some of the symptoms of sleep apnea can be snoring, of course. Morning headache is definitely one. Daytime sleepiness is another one. You really want to focus on a person telling you how they feel when they wake up. You could have a lot of stress from work, daily life, just anything that makes you overwork your head and neck muscles, makes it really tight, and that can actually close off your airway, and that's simple. Other people, they have tissue problems. So let's say that you have an overactive sinus gland and you have postnasal drip, and that actually irritates the throat. That can actually cause swelling in the tissues. That can close off the airway too, and that's an ENT issue. Heart disease and diabetes, those types of things can contribute to sleeping issues, but it's which one fed which. So when we see the patient, the care that we're going to give them is what's been going on, the health history, family history, but then also what's going on in your life right now. Some of the treatments that we have for sleep apnea is definitely weight loss would be the first. It's very conservative, and it's something that you can actually partner with a provider and work on the weight. CPAP machine is another one, the continuous positive pressure for the airway. And if you can't tolerate that, then we have sleep devices, and it's oral devices that actually go in the mouth. The oral devices are probably the most wanted procedure out there because it's something you come in, you take an impression, you get a device, and you go home, and it's not this big machine that's running and has all this noise. Now ultimately, if you see us and you do that and we can't help you, an ENT is on staff too. Now he can check your sinuses, take images of that if you have to. All of this is available here, and ultimately if we find any tissue problems or ENT problems, then that's surgical.